Hello everyone, welcome to my channel. I am Dr. Akash. From today I am starting a new video series, that is Mrcs show shorts. So in this series I'll be discussing the important topics that frequently come in your Mrcs exams. So let's begin with a frequently asked important topic of Mrcs Part A from anatomy, that is of pharyngeal apparatus. So what is pharyngeal apparatus? So it consists of pharyngeal arches which develop during the 4th week of embryonic development, and these come from the outpouching of the developing pharynx. There are pharyngeal arches which are mesodermal in origin. We'll see the pictures in the next slide. And these pharyngeal arches, they fuse in the midline in the ventral aspect. There are 6 arches in number, but the 5th one doesn't contribute much, and it often fuses with the 6th one. Then there are 2 sides of a pharyngeal arch. One is towards the inside, that is called the endodermal side, and the pharyngeal pouches, they develop from the endodermal sides between the arches. Then there is another side towards the outside, that is the ectodermal sides. So namely the pharyngeal clefts, they develop from the ectodermal sides between the arches. Let's move ahead. So as you can see in this picture, so there will be a question, the pharyngeal arch development. It develops at week 4-5 of gestation, and the origin is from the mesoderm. You can see towards the outside, these are the pharyngeal clefts, they develop from the ectoderm, and towards the inside, as you can see, there are the pharyngeal pouches, they develop from the endoderm. And from above to below, you can see that is the craniocaudal picture or head to tail. And on the left side of the picture, you can see the 5th pharyngeal arch, it regresses and it usually fuses with the 6th one. In this picture, let's see what is derived from these clefts and these pouches. Then we'll proceed to the pharyngeal arches. So let's begin with the pharyngeal cleft. In the left side, as you can see, that is the first pharyngeal cleft. From the first clefts, there is the development of the external auditory meatus. Then there are the 2nd, 3rd and 4th clefts. These are incorporated into the cervical sinus. On the inside, there is the first pharyngeal pouch. Its derivatives are Eustachian tube and tympanic cavity. Then there is the 2nd pouch between the pharyngeal arch 2nd and 3rd. It gives rise to palatine tonsils. Then comes the 3rd pouch and 4th pouch. So what is important in this is, from the 3rd pouch, there is development of inferior parathyroid and thymus gland. From the 4th pouch, there is development of the superior parathyroid gland. Now moving ahead, I have some mnemonics for you as well. So let's begin with the pharyngeal arches. Let's begin with the first one. As you can see, I have highlighted all the letters in T and M. So what are the derivatives of the first pharyngeal arch? So we'll be including muscles, then skeletons, then blood vessels and nerves. In the muscles, it gives rise to muscles of mastication, namely temporalis, masseter, lateral and medial pterygoid. There is anterior belly of the digastric, mylohyoid, tensor tympani, and tensor veli palatini. So as you can see, all the muscles name starts mostly from T. Then what are the skeletal derivatives? The first one is maxilla, Meckel's cartilage, and malleus. What are the blood vessels that arise from this one? Namely maxillary artery and external carotid artery. And the most important thing is the nerve, and this is the mandibular nerve, which is a branch of the cranial nerve 5, that is the trigeminal nerve. Let's move to the second arch. First and foremost, we have to remember the nerve of the second pharyngeal arch. It is the 7th cranial nerve or the fascial nerve. As you can see from the mnemonic, it's S. Let's begin with the muscles. These are the muscles of facial expression: buccinator, platysma, then comes stylohyoid, stapedius, and posterior belly of the digastric. The skeletal derivatives are stapes, styloid process, and lesser horn of the hyoid bone. The blood vessel is the stapedial artery. Let's move to the third pharyngeal arch. There is the letter G. The nerve is glossopharyngeal nerve. The muscles are stylopharyngeus, and the skeletal derivative is the greater horn of the hyoid bone. And the blood vessel, we have to remember, it is common carotid artery and internal carotid artery. Let's move to the fourth pharyngeal arch. It has the muscles which are derived from the fourth pharyngeal arch are all the intrinsic muscles of the soft palate and cricothyroid. The skeletal derivatives are thyroid cartilage and epiglottis. The nerve supply is superior laryngeal nerve, which is a branch of the cranial nerve 10, that is vagus nerve. Then we reach to the sixth pharyngeal arch. As we have discussed, the fifth arch usually fuses with the sixth one, and the muscles which are derived from this is all the intrinsic muscles of larynx except cricothyroid. The skeletal derivatives are all the cartilages of larynx except epiglottis, so which basically includes cricoid, corniculate, arytenoid. The blood vessel is pulmonary arteries and ductus arteriosus. The nerve supply of this arch is recurrent laryngeal nerve of vagus. So this concludes our topic. So in Mrcs part A, you are definitely having 1 or 2 questions from these pharyngeal arches, pouch, and its derivatives. We'll be including the important topics in coming sessions. Thank you for your time, friends.